Right now you just started to okay. We are having a bird's eye view of the airway. We are checking that yes, there are no collapse in this area. We can see the epiglottis is open. You can see this lingual tonsils are far away. They are not pushing collapsing. So this is that area of the bottleneck. Right? Again, he has gone into apnea. When you will go into apnea, snoring will stop, his breathing will also stop. There may be some paradoxical abdominal movements, focus on the chest and abdomen, his breathing is also stopped. And if you look at the abdomen, there are now some paradoxical movements. There will be some